Care of the insane has looked many different ways throughout the course of history. In 1850s Victorian England, they were on the age of moral treatment. This meant that the insane were treated well, for the most part, with the idea that they could be cured. Medical knowledge of the time, however, was also highly gendered, which led to substandard treatment of female patients. The first time a woman was publicly recognized as a medical doctor in England was in 1870. Her name was Elizabeth Garrett Anderson. It took until the year 1870 for a single woman to be considered, and only grudgingly so, a medical authority in Western medicine. It would be a long time still until women's voices were considered valid in the medical field. The profession being gendered so, the care of women was entirely entrusted in the hands of men. For Victorian asylums, this meant that care of women wasn't always based on medical knowledge, but an effort to make women conform to the feminine ideals of the time. One way women were forced to conform was through the policing of female sexuality. Sex, at least where women were concerned, was to be for the purpose of bearing children only, perhaps occasionally for male pleasure. Sexuality beyond this lens was thought for a while in this period to be one of the main causes of insanity. Of course, the doctors of the time thought it best, since they knew the cause of insanity, to stop it. Female sexuality was curbed through measures of clitoridectomy, the removal of the clitoris, and in some cases, removal of the outer labia as well. These women were mutilated because it was believed that their insanity was caused by a search for hedonistic pleasure. The doctors believed that if they removed the ability to feel pleasure, these women would be cured. It's worth taking a moment at this point to look at what defined insanity in women. In some cases, it was a search for employment instead of a compulsion to marry. In some, it was being too friendly to male suitors. Others, not being friendly enough. Disobedience, drunkenness, both put in the same category as the cases of true mental illness. Women were policed to conform to societal views of femininity, knowing that if they disobeyed, they'd be labeled insane and thrown away. This of insanity was gendered, so was treatment of the insane. One doctor believed that physical activity was core to treatment of mental illness, and thus he built his patients a cricket field, a place where they could gather in the open air for a friendly game and stretch their muscles a bit. This all sounds well and good, until we ask about the women. It was believed at the time that women would not enjoy such a venture, and if they did, even more so did they belong in the asylum. There was a separate fenced-off enclosure for the women, so they could enjoy the sport in a way suitable to their gender. I'm not sure if I'm missing something, but it seems that to gain the benefits of physical activity, you must be able to partake in such an activity. But that's what the belief of the time instructed. Around 1860, it was commonplace to photograph women considered insane. It was used as a tool in their management. It was a way to ensure these women were forced to conform to the script of femininity. Dr. John Connolly said this of one set of photographs. Her mental perplexities gradually died away, but along with them died the meditative and romantic qualities that had made her appealing. She had declined in class status as well as in sexual magnetism. He spoke in sadness of the health returning to a young girl, saying she had more appeal when she was insane. Shouldn't a doctor be happy that his patient has been cured, instead of lusting after the image of her in the throes of illness? Women were often photographed not as they were, so that their images could capture their experience, their pain, but in fancy wear. Every patient dressed appropriately, so as to seem penitent in their own insanity. After these women have died, and their bodies long ago decomposed, their stories are also lost, as it's not their words we are left with, but with these images of false propriety. After all this time, lost with their stories is the story of their mistreatment. Looking at how these women were policed and controlled, is it so different from how women are treated now? Isn't a confident woman a slut or a bitch? A woman in the lead bossy? A woman without children barren and cold? Women are forced to fit a standard even today. The stories of these women were lost. What will happen to ours?